Hi everyone, I'm Dr. Lin of Rehab and Revived Physical Therapy. Welcome to another segment of Understand Your Pain. Today, our subject or topic matter is frozen shoulder, or some people call it adhesive capsulitis. Whatever the terms, we want to really understand what's going on and some of the tests that can be applied. Unfortunately, some of the tests that can be applied are really done with professional help and outlook. So you definitely want to go to your healthcare professional and have them run through these tests, make sure you have the right diagnosis. I think frozen shoulder adhesive capsulitis sometimes is a blanket term, so really want to find out what the cause of this shoulder capsule tightening. Now the capsule in terms is basically like, think of saran wrap, I like to use, and think of it as this fibrocartilage kind of or soft tissue, connective tissue matter. What happens is, in theory, some people believe that after some kind of virus or irritation or lack of use, these things start tightening up. And so I would say, if you look at muscles, if you leave muscles in a cast for a few days, they've already tightened up. So there's definitely this viscoelastic properties that we want to think about to keep them hydrated, keep them loose. So what I think really goes on in theory, is a little different. I think, yeah, sure, there could be a virus or some sort of trauma. Usually it is a trauma like a fracture, and then you don't use it, and because you don't use it, you lose it. So those are the little things that go on, and then things start tighten up. Now, I have a few other theories that go on, and I think because of repetitive stress or certain postures. So we definitely, when we have a posture video, please watch that. What you could think about is that the bone pushing against the soft tissue or the connective tissue, and really starting to really irritate those borders. And when that happens, guess what? Scar tissue forms, and it's going to adhere. And then the next time you try to move it, it gets painful and inflames again, and then it tightens up some more. So maybe that could be a cause. Another cause I like to think about really has some relations to nerves. So we have our whole brachial plexus. A lot of the times it runs, all the time, it runs from our neck down through our collarbone, down and out. So if these things get impinged, there's some videos that we have for the impingement test, then those can get irritated, and guess what? That also causes inflammation, and because it's outside of the capsule, it really can adhere there too. So those are some thoughts of what really goes on in my clinic. That's what we see a lot of times, and we can really free it up faster. The prognosis oftentimes is don't do anything and let it relax, and then about 6 to 12 months later, then it will unfreeze. So those are the things you want to be cautious about, because you want to keep moving in the 6 to 12 months. And there's different ways we go about it, different strategies, and we'll talk about that next. So here are some tests we like to perform here. And we want to see and really look at the ability of the joint to glide in all directions. And basically there's 6 major directions, and there's some accessory ones we want to have and own. So if you take a look at the anatomy, the chromium process is right here, and then you got your humerus right here. So you want to be able to find that right position and see if she has that. And right now, Stephanie obviously doesn't have these symptoms of frozen shoulder, but if it's stuck, it goes like this, and it feels like mud or quicksand. You hit something, and it becomes really tight really fast. So we're going to check another one here. This is called shoulder gapping, and it looks decent here. We also want the ability of the humeral head to go inferior or go down, and that's a little bit more yucky on her. So I bet you she has some kind of impingement type symptoms where these things are tied up here every time she raises her arms over her head. So that's something that we want to get back and retrieve. Another one is something called caudal glide of the whole humerus, and that's actually also very tight on her too. So what we do is just hold there and run into something. I should be able to go a little bit more freely and have less resistance against that. And then if you want to look at the posterior capsule, I just go that way, I block her shoulder blade, and then I just put some load through. And that's not too bad. There's a bony protection there, so you're going to run into something relatively quickly soon anyways. So those are some of the quick tests we like to do at the clinic here, and we'll go back to the next segment of this video and talk about some solutions. So those are the tests we perform here, and if turns out that your tests are positive, work with your healthcare professional for the best advice to resolve this. But what we do in our clinic, we offer exercises and we start going things manually. So that's what we want to get after and get things on alignment. So what next? If you have this, would you want surgery? Let's avoid that. I think, whether you just don't do anything for 6 to 12 months, but who wants to wait for 6 to 12 months? You want to get moving right away and keep things strong and not let anything atrophy. So one quick solution sometimes is just getting out of the irritating postures. So Stephanie's going to demonstrate, that rounded shoulder. And if you just at home just round your shoulders, you can really feel on your healthy shoulder that you're going to run into something. And guess what? Over time, like I said in my earlier explanation, that if you keep irritating that, scar tissue, inflammation builds, and then it's going to tighten up again. It's going to tighten up until it's frozen. So let's kind of go over what you can do and just keep trying it at home. Is pretend you're around the shoulders here, and you can kind of see, right, Steph, if you raise your arm, you're going to run into something. It doesn't feel very comfortable here. So what we can do is, get yourself, as upright as possible. You want to basically set your scapula or set your collarbone on top of your rib cage, and those are some of the things we want to do here. So I generally tell patients, don't forget to go. You can do one arm at a time. Up. You're going to turn your wrist out and then down. You don't have to squeeze back. You just have to go. Let's go over here. You're just going to go up, turn your wrist out, and down, and then you can do the other arm. Or you can do both at the same time. I say if you can adjust this every 30 minutes, it's probably great for you in the long run, and you're taking away at least some stressors. But we have some great exercises we've done before. Remember, your shoulder blade is 1/3 of your range of motion. Stephanie did a great job before showing scapular clocks or shoulder clocks. And then shoulder setting. Let's get that shoulder away from the front of your capsule that's irritating and bring it back to the center. Those are some great things. Make sure you check with your healthcare professional, see if this is the best exercise for you and it's not going to hurt you, and do it at your own risk. So once again, we have Stephanie here and me, Dr. Lin. If you like what we're doing, leave a like, subscribe, and remember, we can and we will get better together.